This little fellow, we'll call him CF, suffered anoxia. That is actually a lack of oxygen to the brain. You see it in people when they have drowned and are brought back. If they have episodes where their heart stops and oxygen is not pumped to the brain for a period of time. This little fellow was actually in his front yard of his home. He had this episode where his heart stopped. Their neighbor, nurse practitioner, and I don't know the exact, logistics, but how she got to him and restarted his heart, but it was long enough that he suffered anoxia. Wonderful, wonderful family. They do such great care with him, but he's another example of what this neurological tone can do to your body. He has the same, if you look at the right side of his rib cage in that first picture, again, when the body twists and the muscles pull the bones in the spine offline, everything that's connected to that will be affected. So that protrusion of the ribs on the side is very common. You can see how his spine dips down to the posterior, the lower part of his back when he's laying on his side. On the right side slide picture, you see that he has a feeding tube. That protrusion in the lower right side of his abdomen is a baclofen pump, and that has been wonderful to help with his tone and spasticity. It feeds through to, it goes into called an interthecal space, and puts baclofen directly into the cerebral spinal fluid that travels the up and down the spinal column and through the brain. Baclofen pumps, to me, are preferable over baclofen, the pills by mouth. We would say a PO medication. When you're taking the pills, you have to take such huge amounts because only about 5% actually of that medication actually crosses over into the blood-brain barrier through that to get into the cerebral spinal fluid. So you have to take such massive amounts that you worry about 95% of any medication roaming around in your body that's a foreign substance. So certainly people are well maintained on the pills, but if you have total body spasticity, it appears that the baclofen pump is a wonderful invention for those people. But you can see with this little fella, his elbows, his hands, his hip, his spine are all greatly affected. Now, he had a rigid plastic, all-encompassing TLSO that went around his whole body. You're putting a mold. They make a mold of your torso and then make a device off that. And his caregiver mentioned to me that when he put him in it and got him strapped in it, that his body would start to writhe and twist and the hip come up. Right after that, I had a 19-year-old patient, spina bifida, that was totally alert and oriented, and he also had one of the encircling solid plastic TLSOs, and he said the same thing to me. He used that term writhe. His body would twist and the hip would come up. So, if you think about where technology comes from, and I can't help but wonder if at some point in time we had people that had back injuries and a device was devised to hold them in place. So that evolved into, over years, I mean, we may be talking back in the Roman Empire stage, but certainly in the cowboy Wild West days. So that evolved into then the back braces, the total plastic. So did at some point in time in our medical history someone look at spinal curvatures of these patients with neurological tone and said, well, here's a back brace that should hold them in and prevent them from curving because we'll hold them real tight. So maybe that back brace wasn't designed for these patients. It was something that was already there, and it began to be used on them. But let's always look at our patients and, again, watch the body's reaction when we do something to them. Do it, but then step back and watch. Don't go off and just assume that's the right thing to do. Watch and see the body's reaction. If it is appropriate and desirable, that's wonderful. If it just doesn't seem right, then let's rethink what we're doing. Here is this young man with a vertebrae TLSO. You see we still need to work on his elbows and his hands, but it has an opening for his feeding tube. It'll compress the spine. Now, he doesn't have a problem with lack of muscle tone in his abdomen. He has a nice flat little tummy, but the compression we know is very comforting for our patients with neurological issues. Sometimes you can see kids calm a little. We see this with compression with kids with autism. So we know it's comforting, and again, we go back to strengthening the core and to things like Pilates, and we're going to support the spinal cord and the spinal nerves in that conduction. His knees also came out very, very easily. Once the tongue was worked through, and relaxed, they came out into full extension. I don't know that we'll address his feet. That'll be up to his physicians and his therapist. This little gentleman will probably not be ambulatory. His big issue, and he'd already had our pediatric rest air hip for some time, so it kept his knees from coming in and having that hip adduction. But because of his spinal condition, his scoliosis, and the tone in his torso, you can see that left knee is rotated out and the hip is twisted. So we want to, keeping people in proper alignment is so vital. Years ago with hip surgeries, for example, too many people healed with that foot going out, and then they had to walk like that, and some of them it made non-ambulatory. They ended up in a wheelchair. So it's just vital that we, again, try to always be very cognizant of body alignment for these patients. Here's just an amusing little slide. We've come a long way. This could have been contracture management not that many years ago. I found this slide right after some nurses told me about going to an in-service at a large hospital. And a nurse asked the therapist that was doing the in-service why their patients were not splinted soon after brain or spinal cord injury. And he said, because it takes longer to get movement back. And this nurse was saying to me that she was sad because she had conversed with me about how we work through neurological tone and how our splinting is just so effective. And I told her it's nothing bad about the person that was teaching the class, but their frame of reference was orthopedic rigid splints. And we know if you try to hold a body part in that specific plane, which is orthopedic, right? Because you're going for healing and maintaining function. But our neural patients, when their muscle says, I have to shorten, then we have to let them. But again, with that tension, and then bring them back. If we try to hold them in that certain plane, I have seen people bend steel. I have seen people break casts when you force them down real far and put a cast on. I have seen them break that. Because when the body says, that muscle says, I need to shorten, then we have to let it shorten. Work through the tone and then let it relax on its own. This is a young man. It was a rehab hospital. He was back there for maintenance. Traumatic brain injury. It was 3 years after an auto accident. And he looks very much like so many of our wounded warriors who have had, the citizens of our country. These valiant warriors have sustained so many traumatic brain injuries. This young man, you can see him in bed. Now, the amputation, I don't know when that occurred, but it was something either during or as a result of the accident. If we could have just gotten to him soon. But no matter where we are, where they are, we start and we say, okay, what do we need to do to begin them getting back toward normal alignment? We do one thing, two things, and then watch the body. So we had to do something about his spine, and you'll see that TLSO couldn't overcome this horrible tone and that writhing to the right. And his torticollis, his neck, was just so stiff. His feeding tube, the area around it was a little weepy, and so it made the opening even larger, and put a material around it that would not absorb water, so you wouldn't have to wash it that often. He definitely needed some work on his hand, but you can see when we added the safe serve right, you order it in the direction the patient is leaning, that allowed him to start coming up. So he was getting ready to be discharged from that hospital and was going to be back in 3 months, and the therapist promised me then that they would begin to work on his feet and lower extremities. So I would love to see the results today. That was a couple of years ago.